Hello, everybody. My name is Carmen Perez-Jordan. I am a proud Chicana feminist. I am a civil rights leader and a co-founder of Poderistas. We are already living in a reality where for millions of people, it is extremely difficult to access reproductive health care. Without Roll, things will only get more difficult. Over 20 states have restrictions and regulations in place that will nearly ban all abortions. Of those states, 13 have trigger laws in place to outright ban abortion the moment Roe is overturned. This is especially true for Latinas and people of color across the country. Trap laws and many abortion regulations make it most difficult for already targeted communities, including new Americans, low and middle income families, and folks facing a language barrier. Within Latina communities, we also face cultural and faith-based stigmas that can make it really difficult to talk openly about reproductive health care and especially abortion. Today, we'd like to welcome Lupe M. Rodriguez, the Executive Director of the National Latina Institute, to have a conversation alongside Kathy Torres, the Organizing Manager at Frontera Fund. Please join me in welcoming them. Welcome, Kathy and Lupe. Please share some information about your organization, the work that you all have been doing. I just also want to say thank you as a Latina for everything that you all have been doing for a long time and the work that you continue to do.
Thank you so much, Carmen. I can start. I'm really honored to be here with Kathy and with you all today to talk about the state of affairs around reproductive rights, health, and justice for the Latina and Latinx community. And at Latina Institute, I'll just share briefly that, well, the organization is the National Latina Institute for Reproductive Justice, and we go by Latina Institute for short. And our mission is to lift and build the inherent power of our Latino and Latinx community members so that they can fight for reproductive health and rights and live their lives fully with salud, dignidad, y justicia. And we're really excited about being able today to share with everyone about how to join us, to join this movement. It's now or never in this moment, and we need the community to come with us on this journey.
Thank you. Kat?
Hey y'all, I'm Kathy Torres, she, her, ella pronouns, and I'm the organizing manager at Frontera Fund. We're an abortion fund based in the Rio Grande Valley of Texas on the southern tip, there on the border, and we serve the entire border of Texas. We help pay for abortions and provide practical support, meaning covering travel costs and other costs associated to accessing abortion care out of state. So you can imagine the type of work we've been doing since SB 8 has gone into effect. And even before that, historically, Texas has always been very hostile towards abortion, and it's only gotten worse. So I'm here to sort of talk about the work that we've been doing, how we've somehow remained resilient in these trying times, and just have a conversation with, one another on how to persevere through this.
Thank you both. Thank you so much for just, being open to sharing this conversation. I know a lot is at stake, right? Nearly 50 years after Roe versus Wade, there's a lot happening in the reproductive rights space. Let's discuss what's going on with our Supreme Court. Lupe, can you share some background on the Dobbs case? And also what was leaked, what the leaked draft decision means for people seeking healthcare in America, and when do we expect a decision to come down?
Yeah, absolutely. I can share about that. Well, I'll first say that, I forgot to mention that Latina Institute is a national organization with a state-based presence. So we do follow along very closely at the national level on not just like legislative policy, but also on court decisions. And we have been following the Dobbs versus Jackson Women's Health case, which is what is in front of the Supreme Court at the moment. It's a case that came out of a lawsuit in Mississippi against the state for passing a 15-week abortion ban. And the court right now, the Supreme Court of the United States, is not only hearing that case and deciding on whether or not that case is constitutional, or whether, again, the ban in Mississippi is constitutional, but because of the leak that you referenced, so on May 1st, or May 2nd, I forget the exact date now, it's been a blur, but early May, there was a decision that was leaked. It was a draft decision that had been authored by Justice Alito, which not only upheld the 15-week ban in Mississippi, but also showed that the court was intending, or is intending, to completely overturn Roe versus Wade, which is, a separate issue than what was originally sort of in front of the court. And so I want to be clear, of course, that what was leaked is just a draft decision. It does not mean that currently that is the state of the law of the land.
Right.
Abortion is still legal. However, it does have what that is hinting at. Of course, the overturning of Roe versus Wade has incredibly dire implications for all communities in the United States, but definitely in a more exacerbated way for Latino community, Black communities, Indigenous communities, LGBTQI plus communities that have already been marginalized by systemic injustice in this country, and we're worried about that right now.
And if Roe is struck down, how will this impact the Latinx people seeking healthcare?
Well, first of all, if the Supreme Court overrules Roe versus Wade, it will trigger a wave of legislation across the country that will potentially not only ban abortion, but also criminalize it in various states. So we expect about 26 states in the country to enact bans or other criminalization after Roe versus Wade falls, if it does. And so what we know that this means for the Latino community specifically is that a greater point of a barrier for them, for us, in being able to access care. I'll start by saying that the Latino and Latinx community already face very, very high barriers in access to care in this country. We have some of the lowest rates of insurance coverage, which makes healthcare, including abortion care, generally inaccessible for our communities. We also, tend to work in jobs that may not offer health coverage in many cases, or we work in those jobs at higher rates than other communities. We also, have a lot of barriers systemically in terms of where we live and just access to services and care because of systemic injustices, I will say, that have always existed against our communities. And so all of those things have already made it so that right now it's hard for our community to get access to this care already. Removing the protection of Roe versus Wade will add an additional, in many cases, insurmountable barrier for this care, and at least a sliver of protection that we had before, where there still was the right, at least in one clinic or one place to go in a state to be able to get care. What we're going to see is that potentially all of the providers in certain states will cease to be there, and that folks will have to go elsewhere to find the care they need, or self-manage their care, which is another option, of course, but maybe also part of the criminalization and other kinds of barriers and bans that may be enacted when Roe versus Wade falls, if it falls.
Yeah, I think it's so important for people to understand the criminalization that's going to be connected to abortions. And so what I think, we are learning is that abortions will be illegal, but it doesn't stop abortions from happening. Right. And I think that needs to be made very clear. Kathy, want to bring you into the conversation. Could you please speak about the work you've been doing in Texas, a state with some of the most restricted abortion regulations in the country? How does this ruling impact the people of Texas?
Yes, thank you. And Lupe totally did a fantastic job in explaining the severity of the potential of this decision being overturned. You know, there's a lot at stake. But also, like Lupe mentioned, at least in Texas and border communities specifically, we've been navigating a world where Roe v. Wade was honestly the bare minimum. But if Roe v. Wade is overturned, things will get exponentially worse. So in Texas right now, since September 1st, 2021, we'll never forget that day. That was when SB 8 went into effect, which enacted the 6-week ban on abortion and include the civil cause of action, meaning a $10,000 bounty on anyone aiding and abetting an abortion. So we've been doing a lot of work litigation wise, but also as an abortion fund, things did change for us drastically. We've been funding abortion since 2014, you know, and we've always provided both financial support for abortion care and practical support. And I really do want to draw like some perspective. In the year 2020, we funded travel for about 12 people in the entire year because people were mainly reaching out for procedure support at that time. You know, people were able to have abortions up to 20 weeks in Texas. There was still a lot of restrictive laws that made it difficult, which is why we've had to exist. But it was, you know, people were able to stay in McAllen to get their abortion care. And we've always had the same rate of callers, about 40 to 45 callers a month. So that really hasn't changed too much. But what did change is after SB 8 went into effect, we began noticing that every single caller that had reached out to us needed help paying for travel. So you're
Mm,
going from 12 people in 2020 to 40 to 45 people a month needing
wow.
help with their travel care. So that's been the major, major change. We've become travel agents. You know, we got really good at booking flights and booking hotels, and we're still doing that, you know, to this day, helping people the best way that we can get the care that they need, even though we have the big decision day looming over us.
Wow, that is a significant change. And Lupe, you alluded to this, right? As difficult as this is, to acknowledge the lack of access to reproductive health care is nothing new to many of the Latinx and Hispanic people living in the US, especially immigrants. Can you both talk a little bit about this? And not just around abortion care, but other aspects of reproductive and sexual health care. I recently had a baby about a year and a half ago, and it was during the pandemic, and I experienced a lot of trauma. And that's that I'm a English speaking activist. I know how to advocate for myself, and I sat there. Just really thinking about all the women that come to have children and aren't able to advocate for themselves. Can you please both just kind of share a little bit more about that?
Yes, of course, that's a really great question. Something that's quite unique about a border community in Texas, but in the country as well, is I'm in the Rio Grande Valley. That's where we're based out of, and we're on the southern tip of Texas. And in the valley alone, we encounter 4 Customs Border Patrol checkpoints. There are 20 in Texas. And what those are they are set up by the DHS, and they are 100 miles north of ports of entry. So from like Reynosa all the way to Valfuria. So that's about a 100-mile drive. Poray. So at that border patrol checkpoint, it's mandatory to drive through them. And it looks exactly like a port of entry. It's actually very like intense. And Customs Border Patrol agents will have their dogs go around your car. You're under surveillance, and agents themselves ask you if you're a U.S. citizen. You're forced to share that information. So if they don't believe you straight up, they can detain you. If you say no, they will detain you. So it's very aggressive. So if you are undocumented and you live in the valley, you can't go to Mexico to get care there,
Right.
because you risk not being able to come back. And now you can't even travel out of the valley. Yet, if you're past 6 weeks, like you have to, like you cannot get services at a clinic here. So that is the reality that people are already facing with SB 8. Now, these laws and the way that it's set up, just that checkpoint, it doesn't just affect people accessing abortion care. It affects people greatly because that's just one example of how militarized our region is. On top of Border Patrol, we have local police, but we also have a lot of DPS, Department of Public Safety, because of Operation Lone Star, that are acting as Border Patrol agents. We have ICE. We have Border Patrol. We are very hyper militarized. So oftentimes, if you're undocumented, there's a lot of hesitancy to go and get care that you need. We're also in a community that faces high rates of poverty. We're 40% below the federal poverty line. We're one of the highest rates of uninsured people. And if you're undocumented, you're scared to even go to the doctor, or even if there's an emergency because of fear of deportation, or because of situations like the woman in Starr County who was criminalized based off of a pregnancy outcome. So it is really, really, there's so many barriers to care, not just with abortion care, but with other sexual health, even accessing HIV care, people are concerned. So that's a really great question, because you're right. Yes, it affects abortion care greatly, but it affects all spectrums of reproductive health care in very different ways.
Yeah. Yeah.
Definitely.
Lupe, do you have anything to add to that? I
Yeah.
mean, thank you. That was so thorough, but yeah, I would love to hear from you.
No. Yeah, I was going to say, Kathy, I think painted the full picture there of what we're facing. And I think one thing I'll add is about the Hyde Amendment, which of course many folks may or may not know about, but it's basically an amendment that to appropriations bills that bans federal funding for abortion coverage through Medicaid, with very, very narrow exceptions that frankly often aren't applied. And that has created a barrier to accessing abortion services since it was enacted 3 years after Roe versus Wade passed. So it disproportionately affects women of color, people of color, and Latinas and Latinx people specifically. As Kathy mentioned, the Frontera Fund and other abortion funds have to exist because of things like this, right? Where folks might not have the funds to be able to pay for this care that they need. And so I think that's one specific way, but your story, Carmen, is sadly very common about experiencing trauma and experiencing inequity in the face of the systems of care that we have in this country. I'll add a couple of things about just how folks who are newly documented in this country have to wait 5 years to be able to have access to care, even though, again, they're tax-paying individuals in this country and have legal status, right? So we have this 5-year bar. We also have things like, in many states where abortion care isn't even covered in private insurance plans that folks are paying for themselves. There are waiting periods, of course, that exist where, folks have to wait to be able to get the abortion care they need, or have multiple visits to get this care. There are, just other hurdles in terms of reporting and things, forced ultrasounds and other kinds of counseling that pregnant people need to, or are given forcefully. So there's so many barriers, and these are just, specific to abortion. But as mentioned, there are a lot of issues just with inaccessibility and inequity in healthcare in general. And as mentioned earlier, right, like those things have always existed despite Roe. In Texas specifically, were exacerbated by the passage and enactment of Senate Bill 8. And now, of course, with Roe versus Wade, many of the meager protections that we barely had, right, like will be taken away. And I think that that's a really important picture to paint for the community.
Yeah,
And I'll answer. Oh,
go
go
ahead.
ahead.
No,
I
no,
was
no,
just
go
going to say
ahead.
quickly that Kathy also alluded to the fact that the decision is looming, and I know you asked earlier, and I failed to answer that. We're waiting on this decision any day now. Today is what is it? June 23rd, Thursday. There was a decision day today. There will be one tomorrow. So the decision could come out tomorrow, or it could come out Monday or Wednesday, I think, of next week.
Yeah, and I think that's a really great segue into my next question. Well, first of all, I just want to acknowledge the depth of knowledge and work that you all do is just so admirable, right? I think when we have conversations about reproductive rights, we're really missing this lens. And so I'm so excited. I mentioned, I can't wait to share this conversation with other fellow Latinx people and Latinas. But knowing all that is happening at the Supreme Court level, it is scary because it feels very final, right? Even though there's, decisions that are still being that we're waiting for them to be made, it feels kind of like they've already made their decisions, but organizers, activists, and many of our elected know that it's not final, right? What can we do as an individual at a local level to use our voices? Poderistas is all about building power, taking, feeling poderosas, like to go out and take an action. And so what can folks do to use their voices, take action, own our own power, our power to make a difference in our communities, and our power to exercise autonomy really over our own bodies?
Yeah, something that has always been the work that a lot of the work that's already been going on that will always be useful is talking about abortion at the very least, destigmatizing the word abortion and having conversations about it really helps people feel like it's something that is normal because it is. And also, we as people who can get pregnant and can terminate pregnancies, we have always had the power of storytelling and talking to each other and continuing to share information and resources. And I'd say to do the very same thing. People are able to self-manage their abortions, take that care into their own hands, and there's information out there to help with that process. Share that information. Like you all mentioned, earlier, people are still going to be having abortions. Bans aren't going to do anything. All they do is like uplift racism and white supremacy. That's what we see in the work that we do every day. So share that information because the fate of Roe will impact abortion in 26 states, Texas being one of them, with trigger laws. The rest of the country is going to see a major influx in Texans and other. I say Texans because I'm here, but in people that are going to head to those states for abortion care because people are still going to need abortions. So support those organizations, donate to abortion funds in those states, support independent clinics in those states. There's always work that needs to be done, unfortunately, right? I wish we could live in this world where abortion funds don't even need to exist, where abortion can be free and on demand. But we're not going to stop doing work to achieve that. But in the meantime, definitely, these are different ways that you can support.
Thank you.
I'm so glad you asked that question, Carmen, because you're right. It is a very difficult moment that we're in, but I always think about my team, right, who are in Texas and are colleagues with Kathy on the ground in the Rio Grande Valley, and talk about how they've been through so much already, right? Like communities that have faced these barriers down in the past and have faced these challenges down in the past, and it's not going to be easy, of course, and there are going to be really devastating consequences, but we can't despair, right? And I think that that's a really important message here. And as Kathy said, I think there are many things that folks can do. Thankfully, I mean that's the thing in this moment. As I said at the outset, it's now or never for folks to get involved. And as Kathy said, there's so many things to do in terms of supporting folks who are doing work on the ground. So I'll just echo her comments. I'll also add that folks can sign up to be vigilant, to be sort of on call to take action, calling their legislators to the extent that we're able to move things in the legislature to make any progress, like keeping up the pressure there is very important now, as ever it has been. And so I think that's one thing that folks can do. Folks can also, think about continuing to, look at the local landscape where they are and see how they can support. Even in states, I think one thing to mention is folks may think that, say they're in California or in New York or in a state that doesn't, that may not have restrictions happen after the Roe versus Wade case is decided. It will affect us. I'm in California. I know it will affect my community locally, on a larger sort of moral level, but of course also on a practical level. Folks will be coming to the state from other states. There will be an influx of folks on the ground here and in other places. And so it's important to be able to connect to wherever local network you are and sign up to help. And then finally, I'll just say that I think some really specific things that we're doing is mobilizing. There are various efforts in the community. Just recently, there was a caravan that went through the South where we were activating folks in the community and really rallying to alert folks about what's about to happen and mobilizing people. And I think that's going to be really important, like getting out into the streets, really kind of making our voices heard in that way and however we can. I know that you worked on the Women's March, Carmen, and I think that kind of mass mobilization, that kind of mass presence in community is going to be really important in the coming months. And then I think longer term at Latina Institute specifically, we work on long-term organizing and long-term power building in the community. And we know that ultimately is how we're going to get to justice. Like the power structures that we live in right now are not and have never served us really, and clearly now are not serving us or our will. And I think the way that we get to change those power structures is by supporting and continuing to build the inherent power of folks in community who are going to be the ones taking over those power structures, dismantling them, rethinking them, and ultimately being those power holders. So getting involved in that kind of work is also important. So I invite folks to join us at Latina Institute and sign up for the fight.
Yeah, I really appreciate what both of you are saying, and also sign me up if y'all are going to do some type of mass mobilization. I am there with you all. Right now I'm in solidarity with you all, but certainly I'd be more than happy to come down. And I think you could also ask that of the audience, right? Like, come and join us. Not only sign up for to learn more about our work, but also join us in these activations and actions on the ground. Now let's talk about culture. I know that in a recent study by Equislab is, we have Stephanie who is she is one of our co-founders. It was demonstrated that the majority of Latina and Hispanic voters identify as pro-choice, even though those who self-identify as Catholic and evangelical. Why then does it feel so taboo when we try to talk about topics like abortion across generations? How could we really reclaim our power in these conversations? And I know there's stigmas out there, but this is something that I also, when I read this, I was slightly surprised, that our generation, our folks are actually pro-choice.
Yeah, I mean, I can jump in here and just say that is borne out by data that from polls that we've done as well, that the majority of the community are not only pro reproductive rights, they also believe that in sort of parsing it out, that folks should have the legal right to have the care that they need, and that even if they wouldn't themselves have an abortion, they would support their family members or community members in having one, actively doing so. So I think that that's really important for folks to know, that like this is not just an issue of the legality of it, that it's also something that we want folks to have the right to, and that we want folks to have support for. So I think that that's really important. And I don't want to like put Kathy on the spot, but I think what she said earlier about folks like talking to each other is so important here, because that is a way that we kind of break down the stigma around this that has persisted. It is actually true that like about 28% of Latinas will have an abortion in their lifetime. So we are having this healthcare, or taking advantage of this healthcare, and it's a need for us, just like it is for any other community. So I think it's important for us to talk about it, and as the generations go on, to be able to make it known that this is a part of our community.
And it's so true. I know, Kathy, you were talking the importance of storytelling, right? And sharing your story, and I think about like the abuelita. How are we able to tell our grandmothers about our reproductive choices? Is that, or have we gotten there? I remember when I was organizing the Women's March, they were like, well, how do you talk to your grandma about this? Feminism. And I was like, well, she's a feminist. She just doesn't know it, right? So, how can we actually just encourage those conversations, the storytelling, but even more so, like, how do we have those with our own family?
Yeah, I mean, see how safe you are first and foremost. Like that is priority in any conversation, but I say just like do it like a band-aid. That's my family's different because I have parents and family members who are very supportive in the work that I do. And people are always like shocked to hear that because I'm in the valley, I'm on the border, like, oh my God, like Catholicism runs deep. But I mean, I have family who is very supportive. And I have a 90-year-old aunt who every time I'm on the news, she's like, great job. And I have to wonder, do you know why I'm on there? It is so taboo only because we're conditioned for it to be that way. But in a lot of ways, it isn't. I mean, you can genuinely just have this conversation, hey, I got pregnant and didn't want to be, so I did what I had to do. At the very least, but always prioritize your safety. That I can't stress that enough. And also to kind of talk a little bit about like the culture of abortion. I mean, here in the Valley, like I mentioned, people see us as this like very Catholic, religiously and culturally region because of our demographic, right? But I mean, or abortion rights advocates down here and organizers, we've had some pretty good wins down here just by mobilizing our community. We stopped an anti-abortion ordinance from passing in our city. We overwhelmed the anti-choice people that were there. We helped a pregnant person who was like criminalized on her pregnancy outcome get out of jail because we mobilized our community down here. So there's people are pro-choice and like strongly and staunchly. We just need to talk about it more so people can kind of like feel like they can be like they can be that next person on the news talking about it, and their 90-year-old Thea will be like, wow, you did that. So I mean, I've lived it, I've seen it, and it is possible, really.
Yeah,
I agree with that.
Oh yeah.
I'm just going to add quickly that, I think one of the things that I've noticed personally and through the work that we do at Latina Institute is that building trust with people is really important, and that and showing folks that we're not just on the organizing side, that we're not just with the community around abortion, right? That we recognize that abortion intersects and is an important part of healthcare, but in the context of lots of other things that people are facing, that it matters that folks have the ability to make choices around that, to their socioeconomic status, right? To their opportunities for education and for work, for their their liberation and autonomy in other ways, right? Like for them not to for them to make just like larger life choices. And I think that for us has been a really important way. I mean, and I think that that's the reproductive justice perspective, right? That we account for the fact that like abortion is just one issue in a myriad of issues that our communities are facing, and that it's an integral part of having the liberty and ability to live lives that are free and that are safe and that are full of opportunity. And I think that that's another way that we've had some really great inroads with community members who might not have ever thought of themselves as pro-choice necessarily, but know that, you know what, like I am pro supporting my community and pro advancement and pro opportunity, and abortion and the right to abortion is a really integral part of that. And I think that that's part of how we talk about it.
Yeah. And do you all find, like, are there any negative narratives around abortion impact organizing and activism in the space, do you feel? And also, like, my second part to that question are, what are some challenges that you face when it comes to having open conversations with Latinas across generations on abortion and reproductive health care?
I like to say, I don't see any, we don't get, I like to say we don't get pushback, but it's probably because I just ignore it. You know, like I genuinely, yeah. So because we do get a lot of overwhelming support, we really do. But we've had, those moments where we've
Yeah.
tabled and someone who wasn't very nice showed up and said some like really mean things. But we're just like, anyway, just it
Yeah.
comes with the territory, I feel. But that's in terms of the negative work. I mean, we're all, there's a whole look at what these people have been doing, at the state that we're in. So it's gonna come with it. But we just, ignore it and move on with our day. But we don't stop talking about it.
Yeah.
We have a big smile on our face and move on to the next person. And we genuinely, would say, I'm giving an example, like when we're tabling, or when we're out in the community talking to people of different ages and areas. We let them know, hey, we help pay for abortions. And like if everyone is more like, there's people that do that. Like, is it that hard to get one? Because generally people don't know. I mean, like people had thought that abortion has been illegal for like a long time. So we've still had to have those conversations that it is not illegal. You can get an abortion and let me help you.
Yeah.
So I do think that like Lupe was explaining, and I think that's really great that it's like it's not just abortion. It's talking about allowing it's a conversation around allowing your communities to live full lives with safety and dignity. And if you let people know that that's the work that we're doing, we're helping access abortion for people to have those opportunities, people get it. They're like, you know what? Yeah, like this actually can impact me. And tying in sort of like the leak decision, a lot of people saw and heard that, even people who aren't in the movement. And it really triggered this response of, wow, this can affect me. This can
Yeah.
affect my people, and letting people know that this doesn't just affect someone who can get pregnant. This affects communities as a whole in so many different ways. So sort of like creating that imagery and having those like holistic, close conversations really, really does help people shape their view on abortion and go and tell their peers about the conversation that they had at the Frontera Fund table today or at the NLIRJ table they had today.
Yeah. Thank you.
I'll just add briefly that I think that the challenges that Kathy mentioned are real. And, for us, I think where we see a lot of the challenges, particularly with the Latina and Latinx community is with misconceptions, frankly. It's with, folks thinking that abortion is used as birth control, or that, the sort of imagery and stigma around who gets abortions, right? But when you really break down for folks like who, that many folks who have abortions are already parents, the age range for folks having abortions is not like teenagers, right? It's women, again, with children and families. It is folks from all walks of life, and that, folks make this choice with lots of different inputs happening, right? And that ultimately, it's a folks' choice, but really kind of painting this picture that it's not sort of what these kind of like judgmental stigma ideals are, I think is one way that I think you break down a lot of folks ideas that they're against this, and where challenges have arisen. And I think there are, of course, though, folks who will never be supportive, and that's okay. I think, as Kathy mentioned, we kind of move forward with the knowledge that the majority of people are supportive, and that once you're able to really talk to them about it and keep talking to them about it, as Kathy said, you can build bridges, and we found that we're able to do that pretty well.
And yeah, we're gonna wrap up, and I just want to kind of let you all just talk about what are some steps that we can take to bring everyone into the fold when it comes to this conversation. How can we shift the narrative from something culturally stigmatized and taboo to a conversation simply about healthcare? And my personal just question is, how could we bring men into the conversation? I often think about, just what you shared have been my debates with some men, and so, yeah, just want to leave it to you all to give us some steps on how we could bring everyone from our communities into this conversation.
Okay, sorry. Yeah, it's pretty much what we've mentioned. I mean, men are not exempt from this conversation at all. This affects them too. And let them know that it does. In so many ways. No one is exempt from this. Everyone is being impacted by this. People who can get pregnant are definitely impacted by this. But it takes two to tango. So yeah, I would definitely just tell, if you just tell them that as well, like, hey, this affects you too. They have feelings, and they'll be like, what do you mean? And they will listen. So just displaying the facts, breaking the stigma. I know it's a lot of what we've mentioned before, but I mean, it really does work. It does. In the Valley, we hold bake sales for abortion access every year. And we had a news reporter from our local newspaper report on it, and it was such a nice article and informative, and didn't they even used gender neutral terms, and we were just very shocked. But it's because we've been pushing for years and for years and for years to destigmatize that work. So it really does work, and it does really create a culture shift around abortion. So kind of continue talking about it, and just let men know that they are affected and why, and they probably will listen because they, like I said, they have feelings.
I so echo that, and I really loved what you said, Kathy, earlier, just about feeling safe in conversations, and knowing that that's the case, the starting point there. And one of the things that I'd say, if folks don't feel safe having those conversations, especially maybe with men, is inviting them, or if they're in their life, of course, inviting them to things like events that are happening. Actually, one thing that I forgot to mention that we're going to be doing post decision day at Latina Institute is an IG Live. So folks can hop on. If you follow us on Instagram at Latina Institute, or on Twitter, you'll get information to our IG Live. And we're going to be having a discussion there about the Supreme Court case, what it means, in the moment, once we get the decision, whatever decision it is, is, and we will be talking about that. So that kind of thing too is one thing that, you know, if you don't feel comfortable maybe directly having a conversation with someone, I'd say share these resources, share other kinds of things that are in the world. And I think, you know, in my own experience with this, with the men in my life, I think it's helpful for them sometimes to hear from someone else other than me. And so I think that, like, I'd share that as just like in my own experience kind of tip, but also just, again, to that point of safety, right? If you don't feel like you want to engage in that, but like there are other resources in the world, and I think that that's really important. And thankfully, in some respects, like a silver lining of this whole space we're in is that there have been a lot of other male figures who are popular who have been talking about this. So yeah. I'd recommend folks checking out Rafael Casal, who he's done like some shows and things. I think he's shared his own abortion story. So I think, you know, just really bringing those things to the fore is important, especially for that question of how to involve folks who identify as men.
Yeah. And I want you to have the opportunity to just kind of share any call to actions, information about your organizations. How do people follow you? And also really thank you. I am so inspired by this conversation. I'm inspired by your work. I've learned so much just having this conversation with the both of you. And I know that many of the people who are going to be viewing this are also going to learn so much. And it makes me really proud to be Latina, Latinx, Chicana, you know, and to know that there are people like you out there advocating for our communities every single day. But want to turn it back to you both just to kind of share information about your organizations, what's coming down the pipeline, any actions, and to also remind everybody, you know, there's actions happening all over the country, and there's opportunities to really join this movement.
Definitely. Well, I can start and say, you know, thank you so much for the opportunity. It's great to talk to you both and share this space. And again, I'll just echo what I said earlier about how this is the moment now or never for folks to jump on and get involved. We need you. And for us, you can follow us at Latina Institute on Instagram and Twitter, National Latina Institute for Reproductive Justice on Facebook, and www.latinainstitute.org for our website. And really, you can find all of our upcoming work and actions on those spaces. As I said, we're going to have an IG Live the day of the decision, or maybe 24 hours after the decision day, for folks who want to get the latest. And also around activations, we are going to be doing activations around the country on the day of the decision or thereafter, shortly thereafter, and just other kinds of activations and educational work that we haven't yet calendared because we're not sure when this is going to happen. That's been an interesting part of this process as well, as this looms. But folks can find all of the information about what we're up to on these, again, social media or our website. And again, please join us.
Thank you.
Yeah, definitely echoing. Thank you so much for creating this space to share about abortion. I know that's one of our favorite things to talk about if you do this work. So yes, so we're Frontera Fund. We're in the RGV. You can follow us on Twitter, La Frontera Fund, or on Instagram, Frontera Fund RGV. We're also on Facebook. These are new waters. You know, abortion has been the law of our land for many people's lifetimes, mine at least. So these are new waters, if it's overturned, that we will have to be navigating. We are nervous and scared, and we are going to fund abortion to the best of our abilities. And come to decision, we will update people on what we plan to do. So follow us to stay updated, to learn about abortion access, learn about what abortion is like in law in states like Texas, and just continue fighting the good fight. We plan to support one of our very close partner organizations here in the Valley, South Texans Reproductive Justice. I know there are plans to mobilize the community, and we'll be supporting them in those efforts. So lots going on, and the best way to stay tuned is on our socials.
Well, thank you so much, Lupe. Thank you so much, Kathy. We know that reproductive freedom and social justice are linked. Reproductive freedom is a racial justice, gender justice, economic justice, and LGBTQIA issue. And I hope that you were inspired by today's conversation and continue to take action. Thank you so much for joining us.